We are so glad that you are joining us today for the Benefit Buffet, where we offer education about government benefits that assist with the high cost of long-term care, one bite at a time. My name is Jill Pulliam, and I am the owner of Benefit Results, which is a company that specializes in helping families maneuver through this very complicated world of long-term care and how to pay for the care that's needed. We also have a wonderful service called Betty, which is the Benefit Eligibility Triage and Education Line, which is a free service to anyone in Arizona that may have a question about these benefits that we're talking about. We hope that you give Betty a call if you have any kind of questions about these, or maybe something that you hear on this Benefit Buffet today that you would like more clarification on. You can go online at askforbetty.com. That's ask, the number 4, BETE.com, or call 855-477-9896. I'd also really love to give a huge amount of appreciation to Immanuel Campus of Care, who is one of our new sponsors here on the Benefit Buffet. They're an affordable campus of care offering all kinds of wonderful services located in Peoria, Arizona. And we are so fortunate today to have on our program Troy Studeny, who is the Assisted Living and Independent Living Director there at Immanuel. Troy, thanks so much for joining us today.
So glad to be here.
How about we start by you telling us a little bit about yourself? I understand you're expecting your third child soon.
I am. Very
Congratulations about that. And tell us a little bit about Immanuel, if you can.
Yeah, I have been in the healthcare industry for the past 10, 15 years. I have spent the last 7, 8 great years at Immanuel and have really enjoyed the impacts we've been able to make in the community. And I encourage anyone to reach out to Immanuel Campus of Care, ask questions, as we have many different levels of care. If you do have interest, please give us a call. It's 623-977-8373, and we will be sure to answer any questions that you have.
That's fantastic. And you guys are located out in the West Valley, right?
Yes, Peoria, Arizona, right off the 101 in Peoria.
That's a great spot out there. A lot of things happening out there these days. That's great. Well, we so appreciate you being here. And what we have been speaking about in prior shows was that we talked about the different levels of care that Immanuel has to offer: skilled care, independent, assisted living, and some of the challenges with families making a decision that it's time to move their loved one. But on this buffet today, because mental health is such a hugely important part of our continuum of care, I think we wanted to take some time today to not only delve into the benefits that are available for folks that have mental health issues, but what kind of services are available when someone has medical issues that they need to be in an assisted living or skilled care, but then also when they have mental health issues. Troy, I know this is a real compassionate part of Immanuel. Maybe you can tell us a little bit about the mission that Immanuel has in regards to addressing mental health needs of their residents.
Yeah, it certainly is. While we feel that we are very important to have our independent living, our assisted living, and our long-term care, mental health has been one of our biggest programs that we've launched and been so successful with in impacting so many different people that may not have been able to find a place to go. Mental health, like you said, it is a big problem. It is something that many people deal with across not only our state but our country, but helping them and having resources in order to find a place where they can live, have a structured life, and still thrive. That's what we pride ourselves on. We found another demographic in which we can impact, and that is that mental health, and we've done a great job doing it, and that's what we want to show and tell everybody about because it is such a great program.
Tell me, when you're talking about, let's say, a senior who has mental health issues, can you paint just a general picture of someone that would come to mind? Is it someone that has more of a mental health illness like schizophrenia, or is it someone maybe with a substance abuse? Maybe it's a combination?
Combination and all the above. As you get into mental health, there's so many different areas of it, but we can help and assist with many and all of those, from SMI to traumatic brain injuries to schizophrenia, suicidal ideations. Those types of things are the things that make it very difficult for placement. But that's the program that we've put together, and the amount of training and education that our team has undergone to be able to take some of these people in, from partners like psych hospitals, places where they cannot find a successful place for them to go without being sent back out and people saying, I'm unable to manage this person or help them get get better.
Because this is an issue, isn't it? Someone goes to the hospital for an acute episode, and they're not able to return maybe to their previous living situation, and then they're stuck in the hospital because there really is no place that is willing and able to do the necessary programming to make it a safe discharge.
That's exactly right.
Immanuel has been meeting this need for a long time. I think you guys are known for taking some of those harder patients, right?
Absolutely. And we've been known for it, but we've also been known to be very successful.
Absolutely.
Even in the past 2 or 3 years, we have not had to send someone back for their mental health issues.
Wow.
We're able to bring them in and create an individualized plan for that resident to be as successful as possible. And that's the key. And that's one of the main things we talk about in our training is everybody has a different story. You may have the same diagnosis, but it doesn't mean you got it the same way. It doesn't mean it comes from the same, root. But we find whatever the root of that problem is, and we try to address that to make it as easy as possible on the resident. And still the same policy and the same way we look at it is trying to get them at the lowest level of care possible in which they can succeed and thrive every day in their life.
I imagine in order to be successful at this, you have a lot of people that you collaborate with.
Very much so. We have so many partnerships. We have an on-site clinic that we utilize. We have so many different people that have come and been part of this program to make it successful, from our director of our mental health program at the campus itself to all the partnerships we have with you all and others that really know that this is a problem and want to address it with us.
Wow. I would imagine there are folks listening that are surprised by this. There is this general feeling it's a nursing home, right? That's all it is. What I'm hearing from you is not only are you providing independent living, assisted living, skilled care, but there's like another almost umbrella service that if you also have these additional needs, that you are addressing them as part of your plan for them, not sending them out somewhere to have those addressed.
Correct. We have several units at our skilled nursing facility that address mental health and are there for those residents. Whether that is we're able to bring you in on some of our levels and you stay there for the long term, or we're going to work you through our behavioral program, become successful with you, find ways to get you to a place where you can keep going to a lower level of care and hopefully get back out into the community and be able to function and manage yourself by yourself, obviously with support around you, but back out in the community on your own. So
probably another misconception is that nursing homes are just for old people, but I'm getting the idea that what you're saying also is addressing a younger population, right?
Absolutely. I think a lot of people have that notion that it's just, older seniors that are there. Well, no, mental health affects everybody. And the fact that we can help people who are younger, you don't have to be 60 and above, to struggle with mental health. But that's what our campus does best is we don't just have one demographic we want to serve. We want to serve as many people as possible. And it certainly is no way to describe one person at our campus because everyone has a different story, a different age, and it all happened at different times in their lives. What
would be an example maybe of someone that is a younger person, maybe has some disability and now is struggling with mental health issues that would find themselves appropriate for your campus?
Trauma's a perfect example. Things happen in people's lives every day, and then there's something that happens that's very traumatic that can affect the brain, can affect you for the rest of your life. And we try and help with that and help people that need to maybe rebuild that structure, rebuild a way to be successful each day, working throughout all the problems that come with trauma or something like that. That's a perfect example of what we can help people with.
Boy, that's so exciting. In this buffet today, in our upcoming segments, we're going to really take a look at these individual people, what they look like, the services that are offered, why Immanuel is really a provider of choice when it comes to this level of care and nurturing, especially with the mental health population. Troy, when you are if someone is interested in finding out if their loved one would be appropriate, what would be the best thing for them to do?
Please reach out to our admissions department. You can call our main number at 623-977-8373. As for our admissions department, that's where the best place would be to start. There'd be some prompts when you call in, or you can go straight to the receptionist and ask them to transfer you over to Travis Johnson, our director of admissions, and him and his team will make sure to answer any questions and also offer maybe different options in case you called and it's not the right spot or something else that we know of that can assist you and your loved one. But we certainly will make sure to get your questions answered and help you out if we can.
And in that situation, do they have to have a referral from a physician to start asking questions? Or
the best part about starting to ask questions is just ask them. You need to get answers. And once you start asking questions, it starts to help you know what direction that you need to head.
Why do you think Immanuel felt the need to focus on this population? What is the heart part of this mission that you have?
Well, the heart part of our mission, and this is for everybody, is to change lives and serve those who are underserved. So we find demographics and populations in which may not be able to afford it financially or may not be able to just find a program that's able to assist them with what they're dealing with. When you look at mental health and you look at availability of places to go, a lot of people are going to say we don't have any more room to expand. We can't take on more. Well, we were able to. We have a very large campus with an outstanding team of directors and all the staff that work for us. We found an area we could expand. We started to do it, focused on one unit, and we've grown up over to 6 or 7 units now that we've been successful in helping all these people.
I think that says so much about Immanuel and how the heart is driving what is next with business and doing the right thing first. I always say do the right thing first and good things follow, right?
I couldn't agree more.
And I think what is awesome for me and for Benefit Results and why we value you so much as a partner is that we are in line with that helping and making sure that families are nurtured and taken care of and given what they need. I encourage when we talk to families and they are scared about these levels of care to just go and ask questions and tour and see what you think, and don't let the fear keep you from understanding what is available.
Agreed. The fear of the unknown is always something that everyone worries about, but to start asking questions is a great place to start. Visiting, taking a tour, it's a good way for you to make your own judgment on what's being provided in the service and care to these residents.
Absolutely, Troy. Well, we're going to continue through the next segment talking a little bit more about the mental health impact on everyone in our community right now. And we're also going to talk a little bit about the focus that Immanuel has on this population and the services that you provide for those residents. Also want to encourage all you listening, if you have additional questions, you can always call our Betty line. That's a benefit eligibility triage and education line. That's 855-477-9896. Or you can go online to www.askforbetty.com. My name is Jill Pulliam, owner of Benefit Results. I'm here with Troy Studeny with Immanuel. We'll be right back to give you more information about these benefits that help with the high cost of care. Welcome back to the Benefit Buffet. My name is Jill Pulliam, and we are so pleased to have Immanuel Campus of Care joining us today as our special guest. Troy Studeny is here with Immanuel as the Assisted and Independent Living Director. He's also a great advocate for the campus and able to explain what's going on that's so exciting over there. I wanted to mention before we get started on this information about mental health is what we've been talking about previously. I want to mention to everyone that please keep in mind that you have a lot of help out there when you have issues like this. Our Betty line, the Benefit Eligibility Triage and Education line, where you can call and ask questions about anything we've spoken about today. That number is 855-477-9896. Or the Immanuel Campus of Care is also certainly able to answer questions and be a support for you if you have any additional questions. And they can be reached at 623-977-8373. Troy, again, thank you for being here. We have been talking about your very specialized program at Immanuel that has to do with mental health. Can you maybe paint a picture for us if someone has a loved one, doesn't necessarily have to be a senior,
right.
It can be a loved one who finds themselves in some sort of psychiatric hospital for some event. they're at the hospital and now they don't know what to do. What would you say the next steps are?
Well, certainly we try to partner with as many of those, psychiatric hospitals as we can, so they know about us already. But this is a perfect way that if you do have someone there, as you look for placement, we could be one of those options. And that's when asking questions, calling out, and seeing if we're a fit for you to assist with your loved one is a great way.
Would it be maybe someone who, maybe it's the first time their loved one is in a psychiatric hospital, and inside they're thinking to themselves, I don't know if I can have this person come home right now.
Right.
Maybe there's children involved. Maybe there's a whatever kind of home environment that wouldn't be suitable for them to come home. The person's at the hospital, and they are just given a list that says, okay, here are your placement options. What would you have them look for in a next step facility for them?
Well, I think it's all about the program that's put in there and how it's implemented. And we are a program in which we focus on positive reinforcement. We like to find the root of the problem. We like to find what we can do to assist somebody in getting back to their best self. Now, that doesn't mean that everybody is able to come in, be fixed, go out, and everything's perfect. It's a process. It certainly is. And we have several units that help guide us through this program. We have some secured units that requires, that we have our residents and we keep them on that unit so we can make sure that they're safe. A lot of the things you always hear when I talk about Immanuel and I talk about any level of care is safety. Safety is one of the most biggest priorities that we have, and that's for you all at home. If you have a loved one, when you say we can't bring them home, not just safety for anyone in the home, but themselves. Right. And that's where some of the most important things come is finding out what's going on and what our goals are, and start setting goals for residents and setting goals for our staff where we can assist them in getting there and getting there for the long term. We have many different people that come in and they move through our program from secured units to a non-secured unit where they start to get a little bit more freedom of coming and going, but also managing the things that they deal with whatever sort of mental health that they're battling. People
are fearful of placement in general, but they forget that sometimes that placement first helps make the person maybe medically stronger, that some of those issues being addressed so that they actually can do better and live it more independently.
Yeah, and when we talk about placement, I always use the term structure because structure is what a lot of people need. And structure is what helps people become better at dealing with things, emotions, behaviors, whatever they may be. Structure is what helps them be consistent. Consistency is key in a lot of different areas of our life and also in taking care of ourselves.
So the services at Immanuel, then, what you're saying is you're addressing all of those issues, not only the medical issues, but you're bringing in counselors and you're bringing in behavioral health professionals,
yes,
physicians, all of those to be able to identify those needs that the residents have.
Yeah, there's a lot of stigmas when it comes to mental health that the only way to fix it is, with medications or this way. Well, it's a combination of everything, and it's not just one answer to something. It's about finding many different answers to many different problems and how we can make it the best for that person. And so we do that in many different ways. And we've been very successful at it, and that's why we're so proud of it, is we really think we found a program that can help many, many people.
Boy, mental health really is a big issue in our community right now, and it is so underserved, isn't it?
Oh, it certainly is. I mean, we see that demographic grow more and more each year. You hear about it more, and so the bigger impact we can have and the more success stories we can have, the better we're doing, and the more we want to continue to grow, continue to bring in more resources, and utilize great partnerships to keep impacting these people's lives.
Absolutely. It really says a lot about, I think, the Immanuel heart and the Immanuel mission, if you will, to be able to identify a population that is, it's not shiny and fancy.
No.
These are challenging people who need a lot of compassion, and it's a challenge. These are difficult patients to place. Immanuel has chosen to identify that this is a need and also open your hearts up for this population. You're sort of known for this, aren't you? This is sort of what you are earmarked as sort of the go-to place for these types of individuals.
We certainly are, and we encourage, any staff members, anyone who comes to visit us to, it can be intimidating, going into mental health and assisting people with that. It certainly can, but we don't look at it that way because we always look at the individual story. And as you meet more and more people and you help more and more people, you start to see the good in everybody. It's just finding it, and it's finding a way to find stability in everybody's lives.
Hope is a an amazing thing, right? And I think what you are offering to families is a chance for their loved one to get stronger, more stable. I don't really necessarily want to say better because I don't know if that's something that ever goes away, but to be better managed is a big part of living life. And I hear you saying that's a big part of your mission there at Immanuel.
Yeah, it's our mission for the residents to find the best possible position for them to be in. It's also our mission to put families in the best possible position because it's not easy to have a loved one and try and take care of them and not quite know what to do.
Right.
Well, we certainly want to step in and be some of that support, take some of that weight off of family shoulders, and make the impact that we want to on people struggling every day.
So this benefit buffet always focuses on different government benefits that help pay for this level of care. I imagine this is really expensive kind of care.
It certainly is.
And so a family who is looking at this level of care is probably thinking, oh my gosh, there's no way I can afford it. But this is where government benefits come in to be able to assist with this care, correct?
That's exactly right. And that's how we're able to have a program like this, because the majority of people are not going to be able to pay these rates at a private, status where you're going to need that assistance. You're going to need resources and insurance to assist you in order to get the right care.
So what we are hoping with our next segments that are coming up, we want to put a face on this type of issue, and we're going to talk about some really exciting case studies that have happened at Immanuel to show the success and also the impact of this program on their lives. And then we also really want to delve into the different benefit options that can pay for this level of care and to support the individuals that are needing this level. Why don't we talk just for a moment about how people can contact Immanuel?
Yeah, please. You can visit our website. It's immanuelcares.com, and that will give you several different numbers to different departments. But if you just want to call our main number, it is 623-977-8373, and give us a call. You can prompt to any department there or just press 0 to go to our receptionist, and we'll be able to answer any questions.
I love that, Troy. Thank you so much for being here on the Benefit Buffet today, where we are looking at government benefits and understanding how they can help with the cost of care, one bite at a time. Welcome back to the Benefit Buffet. My name is Jill Pulliam, and I'm the owner of Benefit Results, and I'm here with Troy Studeny with Immanuel Campus of Care, and we're talking about something a little challenging today. We're talking about mental health and the impact on individuals who are needing levels of care. It's not a fun topic to talk about, but I'll tell you it's so important. And our buffet today is really focusing on government benefits and how they can help support these families and these individuals with the mental health issues. Troy, welcome again to the buffet, and we're so glad that you're here today. On our last segment, we were talking a little bit about the mental health services that Immanuel Campus of Care is compassionately offering to their residents. Can you give me a quick overview again about the services that you offer at Immanuel, and then we can focus then on the mental health portion?
Yeah, our mental health program, a lot like you would see in any skilled nursing facility, from nurses to CNAs to assist, behavioral health techs, activity programs, all those things tie into the greater picture of our program. And we have several different units in our community to make sure that we have any of your loved ones in the right department, in the right area. And if we have to adjust, that's the beauty of having such a big program, is we can make moves. We can make sure that we have people around, others that they will get along with, and put them in the best environment to succeed. Mm-hmm.
And that also means they can start one place. Yes. And if they transition or do better or need a higher or lower level of care, you're able to keep them on campus.
Yeah, and this is where we see a lot of our successes and accomplishments come in for these residents, to see where they started and where they end up.
Right. I think that's a big motivator for you, I would imagine, is what you see when someone comes into the property after a hospitalization and they're having all kinds of problems, and to be able to bring in all of the resources that you guys provide to be able to find the answers for that individual to allow them to live a higher quality of life.
Yeah, and successes can come in many different ways. They're not always the big, huge success stories that you hear, that they're back into the community and they're doing great. Those certainly happen, and we love when they do. But successes can be very small, too, from going to just being able to get through the day without any issues, without injuries, without, all those things that can happen with mental health. Those are the things that we focus on. And like I've said in past segments, finding the best way to get someone to be able to thrive each day is our goal. And sometimes it looks different for everybody.
Sure.
That's our goal, is looking at everyone as an individual story, and then going at it from there.
So you have an independent living, assisted living, and skilled nursing facility on campus that doesn't necessarily have to mean that you have a mental health illness.
Not at all.
Okay, so this is you're offering sort of like add-on services to address the whole person, is what it sounds like to me.
Yeah, these are units that we have transitioned into, our mental health units that focus on that solely, and that demographic, while also having our traditional long-term care units, our traditional assisted living and memory care, and our traditional independent living. But it helps us also have tools for maybe people in those other areas like assisted living that may be struggling, but we have tools, we have people that are able to assist with those types of issues and keep them right where they're at. They don't have to move, but we make adjustments. We make adjustments how we approach certain things, how we assist them in getting back to their best.
Well, in our next segment, we're going to talk about a really exciting case that you want to highlight. Give us a little nugget of a story behind the person we're going to talk about in the next segment.
Yeah, we touched on it a little bit where with each resident, we look at where they've started and how far we've come. And this is one that we look at that we had such a success with, and some of the things that we heard in the compliments, and just seeing this person thrive every single day in our assisted living, moving through the entire behavior program, is just one that I'm excited to talk about.
That's so exciting. I'm a person that loves to hear stories. I love to hear the impact to the family. I love to hear the outcomes. I think there are a lot of people listening who find things that it's hopeless, that they don't think there are answers. So I love it that we can, in our next segment, that we're going to be talking about a specific case and how your services at Immanuel Campus of Care have really changed the life of this individual.
Yes.
My name is Jill Pulliam, and I'm the owner of Benefit Results, and we offer another line called Betty, Benefit Eligibility Triage and Education, and it's a free call center for all Arizonans to be able to ask questions about these types of levels of care, maybe how to pay for this type of care, which is certainly important, if they're eligible for benefits that will help them. The Betty line is reachable 8 to 5 Monday through Friday, and the phone number that you can call to reach Betty is 855-477-9896, or you can go to our website at askforbetty.com. We're also so appreciative that Immanuel Campus of Care is a proud sponsor of the Benefit Buffet. We're so pleased that they can be a part of our show today, but also that they are supporting the Benefit Buffet with all of our shows. They can be reached at 623-977-8373. We're so glad that you are joining us today, and I hope you stay on board to hear this exciting story of the successes that Immanuel Campus of Care is having with mental health patients in their facility. Welcome back to the Benefit Buffet. We're so glad that you've joined us. My name is Jill Pulliam, and I'm the owner of Benefit Results and a proud collaborator with Immanuel Campus of Care, who is joining us today. The Benefit Buffet is really here to help you get an idea of the different benefits that help with the cost of care, one bite at a time. This last segment of our show today, we're going to take a deeper dive into the services available at Immanuel Campus of Care and how these services can impact the lives of these individuals, with a special focus on the mental health type of clients that they serve. Troy Studeny is here with Immanuel Campus of Care. He's the Assisted and Independent Living Director, and he has been such a great voice for Immanuel today to be able to show the compassionate care that they offer at the Immanuel campus. Troy, thank you again for being here.
I'm very proud to be here.
Very good. Well, in the previous segment, you gave us a little look into a type of client that you find at Immanuel who is struggling with some mental health illness and needs a place to be able to go to get kind of a reset and with all of their situation. Can you maybe paint a picture for us of a type of person that you serve?
Yeah, absolutely. And as we look at many different success stories, and as we look at residents that have come into our facility and started in our program, a couple outshine some of the rest just because they impact you. You work hard with these individuals to give them the best life they can possibly get. And that brings up, somebody that we certainly did that for. Had a resident come in, and like we've said, not everyone dealing with mental health is a senior, right. And that's something that we look at. This is a middle-aged person who came into our facility, was certainly in need of some help. Family was upset, distraught, and wanted this. They knew the person that they loved, but this was a different person that was dealing with something else. And as we had this resident in our program and moved through all the different steps and working with our team, starting in some of our most difficult units and I would say higher secured units, moved throughout the program and started to really graduate and become this person who had goals, set goals, met those goals, and kept graduating throughout our program. And when I say graduate throughout our program, successes always look different for different individuals, but this was an individual that wanted to get back out into the community, that wanted to work again and do all these things, but maybe felt at one point that was never going to happen again for them. Well, with our program and all of the hard work of our staff and the resident themselves, and that's part of it is wanting it and setting those goals. This individual was able to graduate the entire program and get all the way into our assisted living community.
Wow.
Which we don't have all the same, structure and things for that mental health, part of it, where he graduated and came to our community. Little bit of obvious growing pains as you change from a community to community, but was also successful right away. And you could see the difference from day one of moving into the facility, into our program next door, and then coming over to the assisted living and starting to take all the different steps to be independent and be back in the community again. And we got to see that. Not only did we have this individual start to make more friends, be around the community, be involved in the activities, and do all those things, well, then it went further than that, where we started looking for a job. Wow. He wanted to get back in the community and start working again, and really being a part of the community and having a purpose. Purpose is huge for people, and we always identify that as one of the most important things for people to have is purpose, and having this job is exactly that. Wow. We've received phone calls from the family. We did in the very beginning when they came over to assisted living, thanking us and saying, we have our son back.
Wow.
And thank you for that. And those are the things that help keep us going every single day, making those successful impacts, helping these people that probably thought they didn't have any more hope or a chance. We want to provide that again, and the individual is still successful to this day.
Gosh, Troy, that's such a good story. I'm so glad you're able to share that with us, because I think if someone is listening, maybe they're thinking there isn't hope with their loved one. They're not sure that the person can ever get this kind of assistance. Now, there does have to be some things that happen going into place to get this ball rolling, right? There's a lot of intervention that happens. But it sounds to me that what our message out to folks who are listening is that with the combination of medical intervention, whether that's a psychiatric hospital, then a transfer to Immanuel, then to all of the different structured units that you have that specifically identify these root causes of their concerns, can really help someone get to a place that they're much more successful. And that's what we want for folks. We want them, like you said, to be at the lowest level of care possible.
Yeah, and when that happens, it doesn't only just encourage that resident, but it encourages the staff. It encourages everyone who's part of this process in making such a big impact in mental health and all the people that struggle with it.
Boy, then it is huge. We do know that is a huge issue. And I love that Immanuel has embraced this population in which to serve. You have mentioned a couple times that your focus really is on the underserved population. I can't think of a population in Arizona that is underserved more than those with mental illness.
That's right, and that's why I can't imagine being anywhere else, and why I'm so proud to be here on Immanuel's behalf and our partnership with you is the impact we make every single day for so many different people. And all it starts with is asking a few questions, calling in and just getting some information, and then finding out I had no idea this was out there. It happens to me to this day, where I hear about different things that are out there that can be provided for residents, and I absolutely love that. It's us not giving up in them, and them not giving up in themselves.
That's such a great point, Troy. And we are working as a collaborator with Immanuel, we being Benefit Results. We have a program that when someone comes to you and says, we need this program, but we can't afford it, Benefit Results is able to identify different benefit options that can assist with the cost of care. That is such an important part of the continuum, because the way the world works, it is just the way it is. You have to be able to afford the care that you are receiving. Most people, I think the last statistic that I read is that only 5% of those needing long-term care can afford it privately. Mm-hmm. That's a huge number of people that need benefits that can assist with all of these the different levels of care that we have talked about. The All-Tex program is Arizona's Medicaid program that offers basically coverage for long-term care, whether it's assisted living, nursing home. That also includes mental health, doesn't it?
Yes, it does. And I think that's why it's so important that we did partner and have this partnership with you. Is most people who go out and ask the questions, they're turned away from a financial aspect. They don't even get into a lot of the needs for that person because of that financial barrier, and where we can access resources or opportunities to get on the Medicaid program to then assist with those costs and get the care that somebody or a loved one of yours needs.
You're so right. And what we find too is they don't know where to go to get the answer.
Exactly.
They're not sure if you call the state agency or you're on hold for an hour at some other agency. It's hard to get those answers. And that's really why Benefit Results implemented Betty. The Benefit Eligibility Triage and Education line is a mouthful, and that's why we call her Betty. Mm-hmm. And it really is a place where families can call, ask any questions. It can be about Social Security. It can be about veteran benefits. It can be about Medicaid. Really just to say, hey, I don't know what this is about. Am I eligible? Or what do I have to do to be eligible? Our state's program, not just Arizona, but states all over the country, really focus on ineligibility, telling people why they can't. Exactly. It's not why they can. And that's really what Benefit Results and this Betty line is all about. Immanuel has been partnering with Benefit Results. We're going on 8 years now, which is crazy to think that. But we've partnered with you guys to be able to help families when they call you to say, yes, this is the level of care I want, but I can't afford it. What do I do? And we've been able to be your safety net for that with families. And we've had a tremendous success with families appreciating that additional service.
Yeah, and having that service is what makes it so smooth in that transition of you don't have to stop what you're doing just because, okay, we have a bit of a financial barrier. Well, let's get you guys involved. Right away, we don't have to say, okay, we stop here and then there's no other answers. We have answers. We have different avenues. And that's because of our partnership with you that we can explore all of those and find the best situation possible for anybody that comes to see us.
So I have another just quick case study that I thought just came into my mind really quickly about we had at Immanuel was a woman who was getting OPM, which is the Office of Personnel Management. It's like Social Security, but for federal employees. Mm-hmm. Because she had moved around so many times, it was stopped. They couldn't find her. Her check stopped. All of a sudden, she has no income. She can't pay for her care. She's going to be disenrolled from her benefits because of how much this income was accumulating. So now it was like resourced. We were able to work with the Immanuel team and be able to find out the reason why her OPM check was stopped, work with her and OPM to be able to get it reinstated. Not only did it allow her to maintain on her benefits, but then she got a retro check that she was able to utilize for personal things, to be able to, get stuff for her room. She couldn't believe the difference, and that we were able to help her, and that was all a part of our service with Immanuel.
And those are funds and resources that may have never been found.
That's right.
And that happens, and it happens far too often. And that's why having the right partnerships and the right amount of communication for each individual situation makes it so imperative. And that's why I encourage everybody to reach out to you or reach out to us, and we will certainly put them in contact with you because there's just so much out there that people don't know about.
It's so true. And a lot of folks with mental illness that we've been talking about have maybe access or the acute Medicaid program here. They have benefits under there, but there are limits to what the acute plan will pay for.
Exactly.
So finding additional benefits like Social Security disability or other ways in which to help them supplement a rent that they may have to pay or being able to have income to afford an independent living is so vital to the person's success as they get healthier with their mental illness that Immanuel's helping them with, but then also to help the financial piece is also very important.
Yeah, because even from the initial step, if you get things, you find a financial barrier and you figure that out. Well, as you move throughout these different levels of care, more barriers come up and more questions come up, and that's where we're able to answer a lot of those.
Right. And it is a team effort. effort, isn't it?
It certainly is.
I think what we're finding, this collaboration that comes in many, many different forms, whether it's us helping someone get on the acute access plan, or maybe someone finding this lost income, maybe even someone who has absolutely no family member to be able to help make sure that their income is going directly for their care.
And what a great point you make there. There's far too many people out in this world that don't have anybody. Mm-hmm. They're on their own, and their knowledge is all that they have. And that's where we bring in that knowledge, and we bring in the education that we've learned from our partnership with you and bring it to them. Because you're exactly right. There are far too many people out there who just don't have anyone to turn to.
Right. And then what do they do when they're in a crisis, right?
Exactly.
And having one of the things that I think is great to highlight about Immanuel, I don't hear you guys say no a lot. I think what happens when someone comes to you and they have a need, I hear a lot of how can we help them fill that need?
That's exactly right. That's the question we ask is what can we do, not what can't we do. Mm-hmm. And let's find a way, if we can, to get them in here and get them what they need, because our goal is providing that care.
What would you say to a family member who is listening today who maybe has a mom or dad, they're caring at home and they're realizing that they're just getting to a place that it's not safe anymore, they're scared, they don't know what to do? What kind of advice would you give them, Troy?
I give you the advice to follow your gut, and if you think that it's the right time to start asking questions and start looking at options for a loved one, then that's exactly what you should do. It's a tough decision for anyone to make, but when we're making decisions for loved ones, we want to keep them safe and put them in the best position possible, that every day isn't a struggle or isn't a tough test for them, but more how do we make it as easy as possible to enjoy each day.
Boy, and not to let fear keep you from getting what is the best next step.
Yeah, the fear of the unknown prevents a lot of things to be found. If you just ask some questions or just look into it, go to our website, give us a call. We can at least ask some questions and get you headed in the right direction.
Boy, Troy, thank you so much for being here. Our buffet today really has been to focus on Immanuel Campus of Care and the excellent work they're doing for residents and their community, but it's also to give a message of hope that there are services like Immanuel, there are benefits like the Medicaid program that Benefit Results and Betty can help you with, that there are answers. And if you're struggling and needing that help, we encourage you to reach out to either of us. We want to make sure that we leave you today with the different contact information. Of course, the Betty line is www.askforbetty.com. That's the number 4 and then BETE.com, or call 855-477-9896. And Immanuel Campus of Care can be reached at 623-977-8373. Troy, thank you so much, and my best to Immanuel Campus of Care. Thank you so much for listening to the Benefit Buffet. My name is Jill Pulliam. I hope you have a wonderful, wonderful rest of your day. Thank you so much for joining us here on the Benefit Buffet.